The construction industry is a multi-tier contracting system involving many groups. To achieve significant and sustainable progress in workplace safety and health, all groups must work together and embrace a mindset that all injuries and ill health arising from work are preventable. Zero harm is possible. In December 2014, major construction groups came together to discuss what could be done to improve the WSH performance of the industry. Since then, the groups have agreed to recommit themselves to the target of 1.8 workplace fatalities per 100,000 workers by 2018, which will require a 25% reduction in construction WSH fatality rate every year for the next 3 years. Over a period of 8 months, each group developed WSH action plans which focus on 6 key areas over the construction project life cycle, namely leadership, procurement, design for safety, training, WSH culture, and WSH practices. All groups are committed to work together to implement the plans with support from Building Construction and Timber Industries Employees Union, Singapore National Employers Federation, and Ministry of Manpower. As a client, the developer sets the direction for WSH at the start of a construction project. It must do so with a mindset that all workers and end users have the right to a safe and healthy workplace. To demonstrate WSH leadership, the Public Sector WSH Commitment Group and RIDA's members will set clear WSH expectations for projects and communicate them to project stakeholders up front. At the start of a project, the developer will appoint a consultant team that will advise the client and integrate WSH from project setup and design development to inspection of contractors' work. The Public Sector WSH Commitment Group and RIDA's members will appoint consultants and designers that are trained and competent in WSH. To enhance WSH competency for engineers, IES will develop a WSH competency building plan for engineers, roll out WSH courses for engineering managers and engineers. SPM will build members' WSH competency through project managers courses with SCAL. Integration of WSH into annual project management seminar with BCA, and regular talks on WSH with Construction Industry Joint Committee. CISO will raise professionalism of safety officers by developing a code of conduct and develop construction-related WSH courses with institutes of higher learning. To reduce risk at source or design for safety, DFS should be adopted early in a project cycle. The developer should review DFS with appointed designers, contractors, and suppliers to design temporary and permanent buildings and structures that can be constructed safely. The architect will lead the DFS process by planning for safe buildings through architectural design and administration of building contract. In many building projects, the architect also takes on the role of lead consultant who can nurture a WSH culture and have a positive influence on the DFS measures implemented. The Public Sector WSH Commitment Group and RIDAs will provide sufficient time and resources for DFS during pre-construction. RIDAs will drive its members to commit to review options with designers or contractors to reduce or mitigate construction risk, and ensure DFS register is part of the construction brief. SIA will integrate DFS into architectural practice through the SIA DFS Handbook. ACES will publish good DFS practices and encourage design with off-site construction. IES will develop targeted interventions. STARS will facilitate specialist contractors to be involved at the design stage, set up an online library of subcontracting design issues, and share specialist DFS design issues at DFS forums. CISO will run DFS workshop or seminar with other associations. The role of DFS coordination is important to ensure that the DFS process is followed through. Designers trained in DFS can influence the design direction To build DFS competency for designers, ACES, IES and SIA will continue to conduct and review the DFS course. ACES will also encourage member companies to support all senior staff to attend the DFS course. ACES and IES will collaborate to develop a DFS checklist for resident engineers and resident technical officers and incorporate DFS in curriculum of relevant courses in universities. As a procurer, the developer will incorporate WSH and requirements into its tender and contract specifications. Consultants will assist clients to integrate WSH during contracts administration. Subcontractors will factor in WSH costs when tendering for a project. The public sector WSH commitment group will incorporate BizSave Level 3 or higher in appointment of main contractors and subcontractors. Consider main contractors' WSH performance and CONSAS scores from past projects. RIDA's members will appoint contractors who train workers to carry out works safely and work with contractors to price proposed safe work procedures to address residual risks. SIA members will imbue DFS as an integral part of WSH service provided by consultants and assist developers to put proper procurement policies and practices in place, including allocation of sufficient time and resources for WSH. ACES will assist developers to incorporate WSH requirements in price quality method, including tenderers' DFS experience, safety awards, overall risk analysis review, and safety records, encouraging a sum in preliminaries for safety, and ensuring that project managers and senior management from the contractor's firm are trained in safety. SPM will work with RIDAS to emphasize WSH in pre-qualification to allocate sufficient time and cost. STAS will develop WSH procurement guidance for subcontractors and micro builders. CISO will produce online guidebook for procurement that incorporates WSH in tender specifications. At the start of a construction project, WSH expectations must be set and communicated. The developer sets expectations with the contractor to perform in areas such as safe construction, quality, schedule, and budget. The developer will reinforce that contractors and employers to provide a safe and healthy workplace for all workers. The public sector WSH commitment group will include WSH as a permanent agenda item for project meetings and require senior management representatives to conduct WSH site walks quarterly. RIDAS members will commit senior management of developers to conduct regular WSH site reviews with designers and contractors. ACES will work with stakeholders to set aside a separate compulsory session for safety when a project kicks off. SCAL will drive top management from member companies to conduct joint site safety inspections with subcontractors management and facilitate regular inter-site visits between member companies. CISO will conduct periodic dialogue between senior management from CISO and contractors with SCAL. It is important to inculcate a safety mindset in every employee. Effective communication must be established at all levels within the organization and project. The public sector WSH commitment group will develop various incentives with contractors. RIDAS members will develop incentives with contractors to drive and encourage safe behavior and feedback. SCAL will strongly encourage members to organize regular safety campaigns with top management and reward workers, supervisors or subcontractors with exemplary safety performance. The developer will only appoint or work with contractors who can commit resources to train workers. RIDAS will influence contractors to commit time and resources to train workers on construction safe practices and procedures, and have comprehensive site safety orientation and induction programs, which RIDAS will develop with SCAL and WSH Council. ACES will encourage members to design a basic safety course on site inspection for new employees. Employ site supervisory staff who are trained and competent in WSH. Issue personal protective equipment to all engineers. And propose safety control as an agenda of site meetings. SCAL will encourage members to enhance WSH skills and knowledge of their employees, achieve the minimum number of safety training hours per year, and require top management to attend risk management workshops and refresher courses. SCAL will conduct regular courses and workshops on construction safety and regular competency-based training for workers and supervisory personnel. SCAL will also organize forums to share WSH good practices and business cases. STARS will run webinars to train supervisors or foremen and gather good practices for integration into training materials. CISO will provide WSH training through sharing sessions, provide online guidance on annual timeout, and work with other associations to train their members. The developer will exert influence over appointed contractors and designers to ensure that no harm is created. The Public Sector WSH Commitment Group will monitor key WSH data of the projects monthly and outcomes of WSH incident investigations, audits and reviews. RIDAS members will work with contractors to identify high-risk or frequent safety and health incidents, provide clear work safety procedures for construction work with residual risk, and ensure that equipment is well maintained and that workers operate such equipment safely. ACES will invite members to contribute articles on safety and health good practices, circulate construction accidents report and learning points to members, and require construction of temporary works to be closely supervised. IES will identify safety standards for review or development annually and train at least 200 members in design of active fall protection system. SCAL will strongly encourage members to hold regular accident case studies sharing sessions and adopt advanced construction method. To improve communication of WSH practices, SCAL will work with members to develop pictorial guidance for workers. Every worker has the right to go home safe and healthy at the end of each workday, and all of us are committed to make this happen.